I'm Dr. Hodges from Smileland Dental, and today we're going to react to some dental TikToks.
If you guys don't have one of these in your bathroom, I mean, just let me put you guys onto
Fancy.
this. If you still leave your toothbrushes air drying like this, then you might have dookie brush. Well, that's why I ended up getting myself one of these. If you don't know what this does, it has a little UV light to sterilize your toothbrush, and also has like little mini fans in there drying off your toothbrush.
Seems like a super fancy device. I definitely don't think it's necessary. For the most part, we do like to leave our toothbrushes actually more out in the open. Putting them within any sort of a container kind of forms like a breeding ground for bacteria. So of course we don't want to put your toothbrush right on top of your toilet. I think that's kind of a given. Of course, if you're traveling, you can use a little toothbrush holder, but it's actually better to kind of let the toothbrush breathe, if you will. Also with UV light, it does sanitize microbes, but it doesn't properly sterilize. So it's not going to absolutely kill everything. I wouldn't say it's terrible to occasionally use on your toothbrush. It doesn't necessarily have harmful effects on the toothbrush, but I don't believe that the UV light would be able to properly penetrate through all the bristles. I would also say I think that with anything that has UV light, you need to make sure that there's proper safeguards in place. So I almost think it might be a little bit more harmful than good to have something like this, just in case for some reason some of the safeguards malfunction. Exposing yourself to UV light, it's a little bit more dangerous. So I probably would not recommend this. I definitely don't think it's necessary.
I definitely go to the dentist every 6 months, but in between
It's
I
good.
get a little bit of buildup. I have these permanent retainers.
They do tend to get buildup. It looks like a form of like a ultrasonic or Cavatron that we use in the office,
Medium,
but battery powered.
strong. And then when you actually touch your tooth,
So this is what we actually use on patients in the dental office.
it does it automatically. You can also turn that feature off if you just want to like scrape and you don't like that feature. But let's try
Problem
this.
is, it's a little bit risky to do at home. You could end up damaging your oral appliance, which could then cause your teeth to move, especially if you have a built-in retainer or any sort of braces of sorts. It could cause movement of the teeth. So this is just something that I would definitely recommend for a dental professional to be doing on the patients. We use a magnifying glass or loupes to allow us to properly see exactly where it is. So if you're using it, it actually can damage any sort of a restoration that you've had previously done by a dentist that maybe isn't as obvious to the naked eye. So we're able to identify where all of these are with our radiographs as well to make sure that we stay away from these restorations, that we properly are going along the gum line, getting in between the teeth. I wouldn't recommend it also because if you use that too high of a setting, you can end up chipping away the enamel of the teeth, causing sensitivity over time, as well as yellowing and darkening of the teeth because the enamel layer is being chipped off. Also a big thing is you always want to use irrigation with these devices. So you want to use a sort of a water stream to make sure that they're staying cool. Over time, it can heat up and again, cause permanent damage to the teeth as well as the gum tissue. So I would leave this one for the professionals. Happy to do it anytime for my patients, and please feel free to visit your dentist anytime they get this done.
I can't believe this water flosser is on sale for $10 right now.
$10? That's unusual. I feel like there's got to be a cap.
And even a tongue scraper, because we're just not doing background.
Different tips, that's good. The water reservoir is a little small, so you are gonna have to refill it a lot. So that's probably why it's a little bit on the cheaper side. I do love water flossers. Highly recommend, especially if you have any sort of like a orthodontic appliance, braces. I know it can be really tough to floss in between these, as well as any sort of like a permanent retainer or a bridge going on. Water flossers can be great. What you want to look for is one that has different pressure settings. Everybody has different pain tolerance, and you might have more sensitivity, especially when you first start using this along with flossing. So I would recommend you want to start at the lowest, see how comfortable you are. Over time, you can always build up. If you're totally against flossing, then doing the water pick is much better than nothing. But especially for like a perio patient, getting in those gums, the water flosser is great. So if you want to have really excellent oral hygiene, doing both, your mouth will love you. I'm Dr. Hodges. Thanks for watching.